Researchers at Yale University say a particular device has been shown to be more cost-effective than medication at preventing blood clots during irregular heartbeat. Not only that, it also may prove to be more effective in longer-term studies. According to United Press International, implanting the Watchman device in the hearts of patients with irregular heartbeat was more cost-effective than medications, such as Warfarin, which suggests the device could prove to be preferable clinically. The Watchman is implanted in the opening of the left atrial appendage of the heart, where a thin layer of tissue grows over it, preventing blood clots from forming during an irregular heart rhythm called atrial fibrillation, which also prevents clots from circulating in the bloodstream and causing a stroke. While the blood thinner Warfarin is commonly used to prevent the formation of blood clots, the drug increases the risk of bleeding and adverse health events.